nearly 300 maternal deaths a year. That figure in itself needs to help reset society that the issue of maternal health needs to be prioritized. We also hope that with these estimates, countries can take specific review of where they are and look at their progress, their annual rate of reduction, and see how improvements can be made going forward. We do need to accelerate progress a lot more, such that the rate of reduction across the African region needs to be at least 12 times faster than we have currently. Thank you very much, Dr. Adeniyi Aderoba. I lead WHO's program on reproductive and maternal health and healthy aging in the African region.
What do you think ranks highest as priority for the WHO in your area of interest?
So for the area of work that I support, reducing maternal mortality, it's always a priority. And oftentimes that is the overarching thing that we work towards within the program, even though there are a number of different interventions that we do support, but that's an overarching target.
Let's start with the background. What are we looking at in this report? How was it put together? And I see that it's a multi-agency report. Can you also highlight why that is important?
The issue of maternal mortality, it's a cross-cutting issue that requires the support of government. Actually, it should be government-led because they are accountable for the health and well-being of the people. We also have a number of UN agencies that are very much interested in this. So it's on the basis of that at regular intervals, in this case, the last estimates were in 2000. At regular intervals, the United Nations has put together a group to look at available data there, and then they come out with estimates of maternal mortality ratio. By maternal mortality ratio, we mean the number of maternal deaths per 100,000 live births. This group, led by the WHO, also has other agencies like the UNFPA, UNICEF, and also the World Bank as some of the agencies that contribute to these estimates from time to time. And what is usually done is that they look at available data sources from countries, either from their health information systems or from surveys that have been conducted in countries. And based on the data they have in countries, because the data are often not similar, different countries have variations in the way data is collected, and often you also have different time points in data. So they have a model that's been developed that these data are fed into these models and then used to provide estimates for all the member states and across specific time zones. So that's the process. Once this data estimates are generated, we then go back to provide the information to countries through platforms that have been created. And then through these platforms, we allow country stakeholders from these agencies, from the Ministry of Health, from the Ministry of Statistics, as well as other relevant stakeholders, depending on the specific country. They engage with the estimates, they provide feedback, and sometimes there may be needs to be adjustments or additional information provided or clarifications made so that all stakeholders jointly own the process and they can then engage and use the data once the estimates, once they have been released.
When you look at this year's data, what do you find? What trend can we talk about that could give us an instance into how Africa differs from the rest of the world?
So the good thing that we have for this particular year, the report that will be released on the World Health Day, is that we do see that Africa continues to make progress. between the period of Africa has continued to reduce its maternal mortality ratio. Specifically, there's been a 40% reduction, which we do appreciate and we find remarkable. Nonetheless, we must flag that the number of maternal deaths still continues to be high, with the African region constituting about 70% of the maternal deaths worldwide. So these are some of the things we've seen. We've also noticed that in the period for the SDG era, Africa has made improvements in the annual rate of reduction. That's the rate at which maternal deaths drops every year, compared to the MDG era, that's the Millennium Development Goals era, that is prior to 2015. So if you look at those rates before the SDG, the reduction rate was about 1.5% per year, but presently it's about 3.5%, which we see as an improvement. But we must flag that despite this improvement, the rate of reduction still needs to be significantly improved if we must really work actively towards achieving the SDG targets at 2030.
Africa has seen probably the highest growth in this area of maternal reduction, 20% since 2000, but it's still accounting for 70% of global maternal deaths. Does this report provide insight into what is driving this disproportion? I'm not trying to downplay the progress, but do you still think we can make even more progress by targeting some key issues? You can help us identify what could help us accelerate the closing of the gap.
So thank you very much for the question. I think on looking at the progress that Africa has made, we do appreciate the role of government, because mostly high-level leadership political priority has been a very important factor driving change. In countries where we've had stable leadership and commitment of government, we've seen that over the years there's been steady progress in improving the reduction of maternal deaths in some of these countries. We've seen improvement in health systems. Oftentimes, this could be aligned with investments by government, having more health workers, improving the quality of care. And countries are now increasingly focusing on some important evidence-based interventions that could drive some of this reduction. Increasingly, we have interventions such as antenatal care, a focus on skilled health personnel at birth, and we are actually also seeing more countries engaging with postnatal care, both for mothers and newborns after birth. So those are some of the key issues. And beyond the health sector, there are also improvements in addressing the social determinants of health, issues around education, issues around addressing harmful gender norms in society that obstruct the rights of women and girls and contribute to some of the delays that we see causing maternal mortality. These are some of the areas where there has also been improvement. We must also note that beyond issues in the health sector, we do have the external factors beyond what I've said, like issues of conflict, crisis, that seem to be driving some of the burden that we see within the African region. So that could also be areas where focus could be going forward beyond what needs to happen within health systems.
We have these EWNE targets, every woman, every newborn, everywhere. For those that don't know that, can you give me give a quick insight into what that represents? But my real question for you is that only 10 countries have met this particular target, the target of 140 maternal deaths per 100,000 live births. So beyond understanding this target, what can we say differentiates these countries, these 10 countries, from others that are still struggling to meet that target?
Thank you very much. So I must say that WHO and other UN agencies have over the years been supporting the drive to reduce maternal mortality. One of the global initiatives that has been the focus of this intervention is a global initiative known as the Ending Preventable Maternal Mortality, which focused mostly on reducing maternal deaths. There's also a similar initiative for newborns known as Every Newborn Action Plan. Before now, these two global initiatives used to be known as NAP EPMM, which is Every Newborn Action Plan and Ending Preventable Maternal Mortality. But recently, we have them under the same platform known as Every Woman, Every Newborn, Everywhere. And this provides a flagship for some of the interventions that we have cutting across how to empower women and girls, protect and support the mother-baby dyad, and also ensuring country ownership and leadership. So we do have some targets for this initiative. And one of the things that have been looked at, particularly for ending preventable maternal mortality, is that heading towards 2030, no country should have more than twice the global target of reducing maternal mortality less than 70. So if we look at that, twice that target, we're looking at 140 maternal deaths per 100,000 live births. So in the African region, based on the new estimates to be released, we must say that we have 10 countries that have fulfilled this criteria, and we do have a number of other countries that we feel that with current investments by government and sustained progress in the health sector and other things that need to happen beyond the health sector, we will have some additional countries who will also be meeting these targets going forward.
I'm curious to know the difference between the maternal mortality progressions and the trends in Western Africa and the southern region of the African continent. And also, if you can also add the Northern African region. So we are not just using a single brush stroke to describe the continent while ignoring the regional variations. So what insights can you give me about the variations across these major regions?
Generally, like I said, we've continued to make progress across the African region, but presently we do know that the progress is more in the Southern African region compared to the Western African region. So we have more reduction in the Southern African region, also the Eastern African region, with more of the Western and Central being a bit behind in terms of the progress that we've seen, and then the Northern African region somewhere in between these two.
Regarding the countries, like you rightly mentioned, not everyone is going at the same pace. And I'm curious to know the kinds of support available to countries and what you think these countries require in order to make accelerated progression in these key metrics.
Despite progress made, we do have regional variations, with what we said that Southern seem to have more accelerated progress compared to some of the other regions. But even at national levels, we do have subnational variation. So having a single maternal mortality ratio for a country may not actually say entirely how that country looks like. We do have countries that have areas that have humanitarian context, areas of ongoing conflicts, and usually these areas tend to have higher maternal mortality ratio even than the country average where they are. But for the WHO, our focus has been ongoing advocacy, try to ensure that the issue of maternal mortality as well as reducing newborn deaths continues to be a priority for governments for intervention. So high-level advocacy is one of the things that we do. And I must say that at the World Health Assembly last year, WHO supported a process which was championed by 23 countries for a World Health Assembly resolution to again flag the issue of maternal mortality and also call on national government in terms of the investments they need to make and going forward towards 2030. Importantly, some of the support that WHO is offering is around the area of ensuring that countries' policies and strategies are evidence-based, for which we provide lots of technical support to ensure coherence of these policies and strategies with known evidence-based interventions that could accelerate progress. Usually, countries also are able to have data and analysis that show the key issues in terms of the causes of deaths, which in the African region, majority of the causes of maternal deaths as a result of bleeding, either during pregnancy, childbirth, or shortly after childbirth. The other closely related one will be those that has to do with hypertensive disorders during pregnancy, childbirth, or shortly afterwards. So these are the two key clinical causes. Others are issues of infections, abortion, and challenges during the process of labor. Beyond the clinical causes, WHO is also helping government to strengthen and address issues that cause delays in women being able to receive care. So we have those delays that has to do with women and their families taking the decision to access healthcare facilities, and either when they are pregnant or when they do have complications. So issues of empowering women and girls to be able to take decisions around their health, their education, cultural practices that may negate the ability of a woman to take decisions. These are some of the things that can constitute some of these delays. We also have those interventions that address transportation, trying to reach the facility as quickly as possible. And also within the facilities, sometimes there may be delays in accessing care, and also the quality of services, the quality of care in health facilities. Those are additional interventions that supports countries with initiatives to ensure that the quality of care within health facilities are improved.
If you can give example of some of these scalable clinical solutions that WHO is advocating for that addresses postpartum hemorrhage and preeclampsia, which we can see is accounting for nearly 4 out of 10 maternal deaths in the region. What are the examples of some of these solutions?
Antenatal care is critical. Skilled health personnel at birth is critical. Postnatal care is critical. But beyond just being these interventions, they also need skilled health workers. They need essential products. For instance, for postpartum hemorrhage, which is one of the periods where bleeding is particularly contributory to maternal death, that is bleeding after childbirth. WHO recently started scaling up an intervention known as the emotive bundle, which brings together a couple of interventions that are implemented together to ensure that healthcare workers are able to recognize this complication of bleeding and implement necessary measures. Central to this is diagnosis, which means before now, when many health facilities, there were challenges with estimating blood loss at delivery. We now have drips that help to calibrated drips that bloods are collected in during childbirth, and then that helps people to objectively measure blood loss, and then subsequently protocols to intervene are instituted. So that has been a recent important game changer in the management of postpartum hemorrhage. For hypertension, one of the issues has been having essential products around in pregnancy, around the time of childbirth in our facilities. So we do have magnesium sulfate, which is a drug that can prevent eclampsia, that is convulsion in women that have hypertension. Those are some of the things that are there, but all these fall under those three key interventions of antenatal care, skilled health personnel at birth, intrapartum care services, and postnatal care, ensuring that people know what to do. They can identify complications. They can carry out some of the key interventions when the women are with them. They have the necessary products to carry out these interventions, like oxytocin, or even more recently, we have the heat-stable oxytocin, which allows for better storage. The drips that I mentioned earlier, these are some of the key things that are there that WHO is pushing to ensure. And beyond these two key interventions too, we also have the issues around unsafe abortion. Largely, abortion, many of the challenges around deaths relating from abortion, because they are carried out by personnel that are not skilled. They are carried out in clandestine circumstances, largely driven by cases where abortion laws and policies are very restrictive. So one of the things that WHO is also supporting is how to improve the policy base for expanding abortion care services, which may mean liberalizing abortion laws and policies, for which we have 5 countries within the African region now that allow for abortion care services in virtually all contexts, and 40 countries still having varying degrees of restriction, but which has improved over time, allowing for better care for abortion care services.
Just to know whether you have insights regarding what seems to be the best communicate safe abortion practice in the context of its over-politicization, not just within the African communities, but actually globally. What insights can you give regarding these countries that have been able to provide a path for safe abortion that is struggling with the politics and moral questions that seems to be chasing people to unsafe practices can learn from?
I think the issue of advocacy cannot be underestimated. We're really engaging people, engaging communities. It's very important in ensuring that communities provide the environment for abortion care services. And when we say abortion care services, it also includes people who may have early pregnancy miscarriages that need post-abortal care. So they need to be able to have services that can take care of them. So these are some of the things that people need to know. Issue of women empowerment oftentimes is also very critical to ensure that women can aware of their conditions and they are empowered to take decisions for themselves, and also engaging different levels of policymakers to understand or challenges, the challenges that could be associated with unsafe abortion. One of the things that WHO is leading in this area is what we term as strategic assessments into understanding the issues of unintended pregnancies, abortion care services, So in this case, these assessments allows countries to understand some of the drivers of maternal mortality resulting from unintended pregnancies and unsafe abortion. And also through country-led stakeholder discussions, they are able to prioritize different interventions that could help to reverse some of these challenges. Family planning is one very important element of this too, because preventing unintended pregnancies or unwanted pregnancies in the first case is a key issue towards ensuring that when pregnancies ultimately take place, they are wanted, and then individuals as well as societies have the wherewithal to be able to support themselves during that process.
It's also interesting to talk about accountability in the way we document maternal mortality. Trying to paint a scenario of what happens, pregnant woman is brought to the hospital and she actually dies before brought in dead, but she has not been brought into the hospital. Nobody is accounting for that death. The hospital does not record that. The family takes that pregnant woman home for burial, and the hospital, because they did not take care of that pregnant woman, would not say that this woman actually died here. So that data is missing, and which raises the concern of the data that we have. What are your thoughts around letting every maternal death be documented? What mechanisms are in place to ensure that scenarios like the ones that I described are no longer lost in transit?
Thank you very much for raising this very important issue. I think the central issue here is that WHO and other relevant organizations and even government agencies are strengthening birth and death registration. So I think that is the first important thing that needs to be done. The emphasis to ensure that all births in countries are registered, all deaths in countries are registered, regardless of where they happen. With that alone, if that is strengthened, we would be able to capture as many as possible of these maternal deaths, whether they are based in facilities or they are out of facilities. So for most countries, the structures around documenting or reporting facility-based deaths, like you mentioned, they are more developed. And in that case, you could capture them through some of the health information systems in country. Beyond that, those that also occur in communities, there's been lots of sensitization for government to improve some of this reporting. And we do have different interventions, but mostly centered around the community health workers who are able to capture some of these information in communities and then feed them through the appropriate channels to contribute to overall statistics on maternal death. The other issue that needs to also come up when we have estimates on maternal mortality ratio, the reasons why they are one of the reasons why they are termed as estimates is because in many countries where we don't have actual or near complete, some of these are not captured. So some places tend to regard facility-based data as the overall data for maternal deaths, but we do know that the components from societies for communities are not well captured. So that is an underestimation, and that's one of the reasons why this interagency group that estimates maternal mortality have models that takes data from different sources and then can adjust those data to produce estimates that then gives a figure that then represents what happened in facilities as well as in communities. In terms of accountability, we continue to advocate with government to strengthen their systems for birth and death registration for health information systems. We do have units and programs within the WHO that support this, and increasingly over the years, the quality of data that is coming from countries are improving, but we still need more progress in this area.
I'll take that. I'll take that. Then one subject we can also talk about briefly is the issue of health systems and keep talking about under-resourced health systems on the continent, and I think one of the ways that under-resourced health systems manifest is clearly through maternal mortality, emergency care for pregnant women, urgent delivery, access to antenatal care, screening method, availability of resources to safely aid the delivery of pregnant women. So, from the perspective of this report, team, knowledge insight that you have regarding how maternal mortality is being addressed on the continent, what do you think the go-to strategy regarding financing to address these issues would look like? And what is WHO and your unit advocating?
That's a very important issue, and it's even more relevant with the changing global landscape for financing health interventions, particularly in the African region. We all do know that donor funds are reducing over time, and particularly this year with the withdrawal of some of the major countries that fund programs that are in health and also in the area of maternal health. I think the core remains on that government should increasingly have more investments in health. We've had the issue of the Abuja Declaration where countries committed to having 15% of their budget for health. So I think that is something that all of society should hold government accountable for. They should continue to encourage government within the competing priorities to have more investments in health that approach the figures that they themselves agreed to have in health. At the level of WHO, we do have lots of different advocacy programs that helps to ensure or to encourage governments to have more investments in health. We also support specific programs, issues around budget tracking in countries, assessment of national health accounts, such that we look at in countries how much of the budgets are allocated to health. That's an issue, so that we can use that as advocacy to government to increase their funding. Then also for the monies that get to health, we now track them to see how they fund different programs, including reproductive and maternal health. So that way we could even see how maternal health compared to HIV programs, compared to immunization or other essential elements of health are functioning within that portfolio. One of the key documents that will be released in the next few weeks as part of the year-long campaign for the World Health Day is the analysis of these national health accounts in countries to show how much of the budget goes to health, and for those that get to health, how much comes to reproductive, maternal, child, and adolescent health, and so that countries can see their spending pattern, and we can correlate some of these investments to how the drive to accelerate progress in reducing maternal mortality is going. So those are some of the efforts that WHO is supporting in this particular area. We must acknowledge that this data is not easy to come by in country or not available in some. So there's also a lot of advocacy in that sense to increase transparency and tracking, so that forms the basis for which society can also hold governments accountable for how resources are going to health, but also specific areas of health. Yes, I think like all areas, we do have the maternal health landscape is impacted. And yes, WHO is still working on producing results of an analysis that may give some high-level results of the impact. What we do know already is that some countries have and some organizations have reported positions that are being lost. We do have logistics and supplies for some essential commodities, accepted family planning that are donor-driven that have been affected. We do have non-governmental organizations in maternal health across different countries in the Africa that have been defunded. Even within the WHO, we do also know that the funding gap is affecting the organization at global, regional, and national levels. Organization is seeing how to mitigate some of these challenges, but across all levels, from government, from donor-supported programs in countries, products, logistics and supplies, some free maternal health program in some countries. There's been really varied impacts of the reduced funding, and particularly the recent withdrawal of the United States in some of the global health funds for different health programs. So we are continuing to monitor the landscape, and I feel that in the next few weeks, there will be some specific high-level results of analysis that are presently ongoing.
I'm curious to know if the current trend pose any threats to the maternal health aspect.
Definitely, these changes in investment is a threat to achieving some of the targets that we've set globally, and also country level targets for some of the countries. It's really a threat. There's been different models by different countries trying to estimate the impact of what this will be to maternal mortality reduction. I may not be able to give a figure now, but I must say that this is going to, the investment will definitely be an issue in terms of how we work around the targets. At present, the estimates that we need to globally prevent at least 700,000 maternal deaths if we are to approach the global targets of having less than 70 maternal deaths by 100,000 live births. Some of these reduced investment and the associated challenges may mean that we may not be able to prevent as much as the 700,000 figure that I've highlighted. But even before the issues of some of the defunding or reduced funding occurred, we do already know that despite the progress that is being made globally and in the African region, the rate of progress in terms of annual rate of reduction is not sufficient. We do need to accelerate progress a lot more, such that the rate of reduction across the African region needs to be at least 12 times faster than we have currently. So if we were talking about 12 times faster with the existing projections that we have, some of these reductions in funding, we also have an impact in some of these projections going forward.
So look, in spite of what has been happening in financing, are we seeing anyone, any government or any other agencies stepping up to at least improve or attempt to step in and make some interventions that could minimize the very serious impact of the funding landscape at the moment?
Yes, all agencies, and I can speak maybe for WHO, we're also aware of some governments that are implementing different efficiency measures to try and mitigate some of these challenges. In terms of funding and donor landscape, we are still monitoring what that looks like, and there are high-level advocacy by WHO leadership as well as other concerned organizations and government to see if there are countries that can step up and also close some of the gaps that are being envisaged. But I'm sure we are monitoring the global terrain and seeing how some issues of crisis, conflicts are also making it challenging for governments to take some of these critical decisions, and how that is shaping some of the investments that we may see going forward. But being that as it may, we've had countries reorganizing their health systems to ensure more integration of services, such that standalone programs, maybe for family planning or for immunization, and some of these other standalone programs are integrated to ensure more efficiencies. Advocacy is ongoing for countries to actually step up their involvement, their investments in health. That's a necessity in the current terrain. Countries need to step up. There are also discussions across agencies, across non-governmental partners to collaborate more, so that there will be less duplication of this support that goes to countries or programs in countries, so that countries can also be empowered to streamline and align their activities, such that existing donor funds or different stakeholders that still engage in health and maternal health, their activities are streamlined to be more efficient. Some of these can help to increase efficiencies of the existing funds available, investments available as of today. But the critical thing will still remain that countries will need to invest more in health, and particularly maternal health, which has also been dwindling over the years.
I'm curious to know what you hope the impact you hope this report will have, and how you hope the data contained in the report will be used.
Yeah. The critical thing is that we hope it calls attention to the issue of maternal deaths again. Nearly 300 maternal deaths a year. It's an issue, and I think that figure in itself needs to help reset society that the issue of maternal health needs to be prioritized. So that's one thing we hope will happen. We also hope that with these estimates to be released, countries can take specific review of where they are and look at their progress, their annual rate of reduction, and see how improvements can be made going forward. It also calls attention to the fact that it's not impossible. And even within the African region, the fact that we have 10 countries, like we said, who have met win targets of not having more than twice the global SDG targets of lowering maternal mortality to less than 70 by 100,000 shows that it's doable. As part of the World Health Day campaign, the African region is also going to release a series of reports and country stories and best practices to show that it's doable. It's doable. There are countries that have made significant progress in the African region, and we have lessons and best practices for them to show how sustained investment in health, focused leadership, deploying evidence-based interventions can help to make significant progress within the African region. So these are all the things that we hope this report kickstarts. The World Health Campaign this year centers around maternal and newborn health, and it's a year-long campaign where there will be a series of activities, different advocacy, and other reports that we help to situate where we are and provide solutions as to what needs to be done going forward.
Yeah, this has been fun. So what are your last remarks for?
Thank you very much. My last remarks, particularly considering that you from the media, is that all hands need to be on deck. We have what countries need to do. We have support that needs to come from donors, international development partners, local NGOs. But for the media, you are the voice of society. We hope that you continue to put this issue on the front burner of national development, call attention to it so that together we can all ensure that pregnancy does not have to be a death sentence. It can be an issue of joy to families and society. These deaths are not just numbers.
Thank you very much. I really enjoyed having this conversation with you.